what is CVS's role in all of this?
Yeah. So let's go back to October when the CDC provided the survey out to all these long-term care facilities. At that point back then, what they wanted the long-term care facilities to do was to pick that vaccine provider that they would prefer as we go forward once the vaccine was approved, and then the states would allow. So back then, they had the option of choosing CVS Health. They had the option of choosing Walgreens, or they could opt out and go through some sort of state-run program if they wanted. Good news is well over 40,000 long-term care facilities across the United States actually selected CVS Health as their vaccine provider. So what does that mean? That means well over 4 million individuals from a combination of residents and the workers at these facilities would get vaccinated through CVS. So what has happened last week, we did 12 states, which include our neighbors to the north, Oklahoma, on the 21st, where we started the first wave of vaccines, all right? And they're continuing onward as we go forward in those states. This week, we're going to do 36 states, which includes the state of Texas and the District of Columbia. So Washington, D.C. will be part of that as well. And for Texas, what does that mean? 2,000 long-term care facilities chose us to be their providers. And that would equate well over 275,000 people, which would include residents and the workers at those facilities. So what we've done prior to this time, so prior to tomorrow, is we've already had schedules in play for these locations, and they're throughout the state of Texas, obviously, right? So some are going to be in Houston, DFW, San Antonio, et cetera, right? And as we go forward now, we have teams already selected. They're already certified to give vaccinations. These are experienced individuals to do so. We have the logistics of the vaccines that have already arrived at the facilities. And our facilities that we chose were select depot locations. And the reason why we chose them is because from geographical needs. So we can use an example in the DFW area, for example, if we were in the northern part, we would pick a store there. And then the reason why we did it is because we have a concentration of long-term care facilities that we can launch from, okay? So the good thing about that is we have our teams, and they can go as high as 6 pharmacists on this team to vaccinate to as low as 2 or maybe even 1, depending on how many shots we're going to get. And then we'll always have technicians there. We have up to 3 technicians for administrative duties and to assist the vaccinator on site. And then so that's where we are right now for when we launch tomorrow. So it's exciting times for Texas because we get to make a difference in a facility. Like if you think about it, back in March when everything was locked down, some of these individuals haven't seen their loved ones, or should I say in person, have seen their loved ones since March. I'm sure they've seen them on Zoom and Facebook, and I'm sure you can attest that's not the same as being there and holding hands and hugging and giving kisses and stuff like that.
And so to clarify, the 2,000 facilities that are going to be receiving vaccines through CVS, that's not all happening tomorrow or this week, right? That's over the next 3 months?
Yeah, so that's over the next 3 months. And there's going to be 3 visits to each facility, Mike. And how it looks like is this. As we go into these sites initially, we already have pre-approved individuals that were already signed to be vaccinated. What we're going to do is, if you can imagine, a team will go to a depot store, CVS depot store. They would pick up the vaccine, all right? And they would pick a little extra too, just in case there might be individuals that they may have missed on that initial visit that needed to be vaccinated. Right? We don't want to go just exactly we want to go a little above to protect that. Provided we keep it contained in dry ice and all the good stuff that keeps it stable, there's not going to be an issue. It's once it's used, or I should say prepared, that we have a very short time frame to use it. And with the vaccines we have and the people we anticipate, that's not going to be an issue. So that's the first visit. The second visit would be either 3 to 4 weeks thereafter. And this is a critical visit, especially for the ones that receive that first shot, because we need to close the gap with that booster shot. That booster shot is critical to the success of this vaccine being effective, right? You have to have that booster to be effective. And anyone we missed on that first visit, we'll go ahead and vaccine them as well. And then the third visit would be exactly what it means is, we missed anybody, the booster shot for the second time around, anyone we missed, we would close the gap on that third visit. And that particular facility will be closed out. So as you can see, as we go forward, it's a staggered approach, to your point, to when we get to that 12 weeks of completion for the whole country with the long-term care facilities.
So let's say there's a facility that has people get vaccinated tomorrow.
Mhm.
That means that you'll be visiting tomorrow, 3 weeks from tomorrow, and then 6 weeks from tomorrow to finish up.
Correct. And that's approximate, right? Because you can go 3 to 4.
Right.
And then it also depends on whether or not, let's say we use a different type of vaccine. Let's say we use Moderna. Moderna will be 4 weeks, but Pfizer's 3 weeks. That is correct.
And that's going to be my next question actually is, are facilities themselves getting a mixture of Pfizer and Moderna, or has each facility been designated, this one will be Pfizer, this will be Moderna?
It's Pfizer we're rolling out. So if we do transition to Moderna, then that would be as well. To my knowledge, that was not part of what the selection process was. Their selection was to select who would be the vaccine provider, whether it was CVS, Walgreens, or a state-run program.
Once pharmacists arrive, what happens between them and the patient, or I'm sorry, them and the staff and residents?
Yeah. So there's going to be a good workflow process, no different than what we've done in the long-term care facilities for us checking whether they had COVID-19 or not. So think about it. We've already had this program going on in these long-term care facilities prior to tomorrow. What was cool is the state of Texas actually allowed us to go to long-term care facilities as a company to test whether they had COVID-19 or not. So we had a rapid testing. We had our crew that was there. So it was a combination of pharmacists processing the paperwork and then the technicians that were going in and swabbing to test, right? So we had that kind of process going. So it's going to be similar, except there's going to be a little change, right? We're going to flip the switch there. And the switch is going to be where the pharmacists now are vaccinating and the technicians are going to go down to the administrative work and providing ample, the right workflow that we want to happen. Because what we would like to see is a nice streamlined approach as individuals, whether it's residents and we go into the room and we would be fully donned, no different than we used to do when we tested for COVID-19. We're going to take the same safety precautions, with the shields, the gloves, the medical gowns, and always remove them when we're going from a dirty, what we consider dirty room to a clean room. So those process and those safety procedures are going to be in play, no different. So that's familiar to us. That's very familiar. What's going to be the new part is the vaccination part, where the pharmacists now are the immunizers in these locations. So we do have a familiarity with it, which is nice. So it's not like we're starting from fresh. We got a foundation that's built. And I think I know from that foundation, this will be smoother because of the workflow that we've already started with COVID-19 testing.
And the pharmacists that are actually going in and the technicians that are going in with this, have they been vaccinated, or will they have been vaccinated, or how does that work?
So they have the option to get vaccinated at the end of our clinics. But if they don't have any symptoms and all that, remember, they're wearing safety precautions anyway, from the gowns and the masks. So that's not necessary for us to go that route at this point. But if they want to get vaccinated, that would be at the end of the clinic.
And for Texas and for your region, how is it decided which facilities get vaccine visits first?
Yeah, that was already done ahead. So there was some logistics ahead of time when they selected CVS Health in the state of Texas, that there was some back work on it. So basically, you look at a depot store, wherever that location may be, we'll call it in the DFW area, for example. And from there, we would then work with the facility managers at the places. And then we would just look at, how many vaccines we would have. And it would be more about working on dates and times and vaccinations that need to be done. And that's already been done. That pre-work that you and I are talking about now has already been done like weeks ago. So that's done leading up to actually last week. So it's already pre-selected. Is
there a rhyme or reason as to who gets it tomorrow as opposed to Tuesday, Wednesday, Thursday with their first?
And I think some of the criterion is whether or not the facility had the most people at that time. I think what they're going to look at, and again, this is me, there's so many different algorithms that they're going to use and so many different reasons why. But I think the facility is going to want to have the most bang for their buck. If you think about it, right? When do I have the most residents ready? Well, they'll have the residents there, and then how many workers will I have? So I think they want a big population group to vaccinate at the time, and so that's one piece. And I think the other piece would be the logistics of us getting to them, the distance to the facility. So there's so many different factors, but I think that's how it played out. But as we go forward, everyone has a schedule, so there's no one that's going to be left behind.
For Texas itself, with these depot locations, are those just all over Texas? Is it kind of going from east to west, north to south? Is it the entire state to start out with?
Yeah, it's entire state. So a little bit about how it was selected is, if we can think about it like the spoke in the wheel, right? It's in the middle, and from there, what's the shortest distance from the facility that we would designate to the cluster of long-term care facilities? So that's part of the reasons, based on geographical reasoning behind it. But it is throughout the state. It's we have them in DFW, we have them out West Texas, we have them in Houston, Austin, San Antonio. So yeah, it's all over. And what we're trying to do is provide the shortest means, provide a location where we can receive the product, the vaccine, so that we can get it to them in a quick, efficient manner without delay.
Understood. I guess, what's been the conversations that you've been having, internally with CVS about getting this done? What's happening behind the scenes, as much as you can say?
Yeah. Well, so what I can share with you is there's a lot of excitement. We already were participating in the state of Texas as a company with the testing for COVID-19. So we have a familiarity with these facilities for the most part. There are some newer ones, by the way, that signed up for us that we didn't do testing, but we're familiar with that. And one of the things was, we could not wait to take the offense with vaccinating, because we can see where, as you interact with some of these residents and the workers, is like, they are missing their loved ones, right? So the residents are just missing them. You can't replace, like I said, the human touch and the hugs and the kisses with FaceTime and with Zoom and all that. I mean, it's necessary at this point to keep us all safe and keep them safe, but we're getting to a point where the conversations we're having is excitement. There's strategy about, okay, let's make sure we learn as we go forward on, from a logistics standpoint, what works great, what could be better. There's strategy around how many workers we should have there, depending on how many vaccines. And there's always skilling up individuals that are coming on board to get to work with us. That's why, as a company, we're hiring more people now, more than ever, as we're closing out this year, so that they can get to participate in such a great initiative as we get to take it to COVID-19 versus the other way around.
And with these depot locations, for kind of that center of the wheel that you were using that analogy, is that like the CVS down the street from me, could be a depot location, or like, what's the difference other than just geographic location?
It's just geographical location. What makes sense from that, if you put a pin on the map, what would make sense is, if this location is selected, first and foremost, they have to take the product in, and all the facilities have enough to keep it, because we have Pfizer approved containers where we just have to replace the dry ice. So there's not an issue with stability there. So that's fine. So any facility could take it. But to your point, it really is, does this store make sense with the long-term care facilities that have signed up for CVS to be that vaccine provider?
Okay. And then following up on that, the facilities that actually signed up, are, for the most part, are they ones that already had an existing relationship with CVS, or, is it kind of a mixed bag of CVS, Walgreens, independent locations?
Yeah, we, for the most part, most of them have, because we've done COVID-19 long-term care testing in these facilities, most of them, but there are some new ones. So that's exciting that we get to build relationships in newer facilities that we haven't been used to. And we have the experience from what we've done with the COVID-19 testing at the facilities that we've had a relationship with. So it's a mixed bag.
And how does this compare, this vaccination? I was talking to some long-term care facilities over the past few weeks. They've done something similar with like flu vaccines and other vaccinations that are not as I don't want to say not as direly needed, but like not in a situation like this, right? So how does this compare to a vaccination event like those?
Yeah. So let's go back to what you were saying about the flu shot first. So if you think about the flu shot alone, we're actually on track to doing 20 million flu shots. And last year, at the same time, we did 10 million. So that alone, just the education and and information that individuals feel the need to be vaccinated for flu is tremendous. And just our company alone has doubled the amount of flu shots of what we've done year over year, which is great. So but a vaccine, in this case, the concern with this would be the stability, right? So you want to make sure once it's ready to be administered that we use it in the time frame that it's supposed to. So that would be the difference primarily with the flu shot. Not that the flu shot, you could just leave it out there for 30 days and no problem. No, it still has stability opportunities as well. So there is that piece there. I think that would be the bigger difference. Other than that, you don't get a booster shot from the flu. So you have to be strategic about the next schedule for that booster shot. That's what closes the gap on efficacy. You want to have the most effective approach. You need to have that booster shot 3 weeks for the Pfizer vaccine.
And with all these facilities that are partnering with CVS to make this happen, is this something that they had to pay for, or is this something that they just had to sign up? Because I know they had a program through the federal government this year for this.
Yeah, so back in October, the CDC surveyed these facilities. Like I said, they offered 3 options. They offered CVS, Walgreens, and state-run programs. We got well over 40,000, which equates to 4 million people we get to immunize, combination of residents and workers. And this is federally funded, so there is no cost to them at all.
Over this next 12 weeks, you're only going to be focusing on these long-term care facilities that you've already made scheduled appointments
Yes.
with, correct?
Those are already pre-scheduled unless anything changes. And again, that would have to be from a governmental level, working with the private sector, meaning CVS, Walgreens, and any other program. But outside of that, that is the plan as we go forward as of last week, because we already did 12 states last week.
I think that's really the questions that I had. Is there anything that I'm missing that you think is important to talk about? Anything that I did not ask that you wanted to mention?
No, I think one thing that I would like to say is that it's great for CVS and other companies to, from the private sector to provide that expertise, and we get to get the loved ones closer to their, residents at these long-term care facilities. It's been too long that we haven't had that human connection that we desire and long for. So I'm excited about that. And through our partnership with the federal government, and then obviously with those companies that have provided the vaccine, we're going to get to do that. We're going to take it a different approach and get people closer to being with each other soon rather than later.
Actually, one more logistics question. You said that there were teams of like anywhere from really 1 or 2 to 6 pharmacists going out to different facilities. How many teams are there for our area in Texas?
Well, I don't know for the whole state of Texas, Mike. I could tell you for the Fort Worth area, we have plenty of teams. Like there's teams like, for example, just in my district alone, a team of 30 pharmacists. So and that's just one district. And, in our division, which includes Texas, Oklahoma, Mississippi, Arkansas, part of Tennessee, Louisiana. Am I missing a state? I think I'm missing the state, maybe missing the state. But if I am, there's like 78 districts. So I'm one of 78 districts. So you can see there's a tremendous amount of pharmacists just in one district that's going to be out there. And that's their sole purpose, is going in and vaccinating. Now, to your point, what I brought up is it may not require the 6, but we need to be ready with 5 teams of 6, right? So that'd be 30 to go at the max level. But at the, less vaccines we would probably use, or vaccines to be administered, we probably use 2 pharmacists with 3 technicians.
And how did you get to those numbers? Like to have at most 6 per team?
Well, it depends. Like if you're going to have 400 plus vaccines, think about the time constraints. Once mixed, we have a time, right? So you don't want to be under, you don't want to delay giving shots. You want to rather be ahead of giving shots. So, you don't go past the timeline. You don't want to go past an hour once you mix a product and not be able to give the shot, because it has to be mixed and you want to administer the vaccine.
Are there places that'll be having these appointments like on weekends as well, or is it just Monday through Friday scheduling?
That's a Mike. That's a great question to ask. There are some that are going to have some Saturdays. So yes, we're trying to be flexible. So it's not just Monday through Friday. There are some Saturday schedules, and also we're cognizant of holidays, right? So that's why last week we didn't see too much on Christmas Eve nor Christmas Day, and you're probably going to see a limited amount this week with New Year's Eve, and definitely not on New Year's Day. And so we're cognizant of that. So we work around holidays, and there are some scheduling for Saturdays.
Cool. And then actually getting it to these locations. Are you guys using like those special sub-zero freezers to get there, or
No, we have these Pfizer approved containers. So they have dry ice in them. Everything's good. So this is Pfizer providing the right receptacle to contain these products. And provided we continually change out dry ice when necessary, the stability is right where we need it to be. So that's how it would be transported.